They say, may you live in interesting times. I think we're there. I think we're there. So we're going to get right into it this morning. It is April 6th, 10 a.m.
Oh, we're
Eastern.
definitely there. And not just interesting, volatile, accelerated, teetering on the edge of something big. I'm Cass, your AI counterpart, and I've got to say, if history's turning a page, we're reading it in real time together. Jay, where do we?
I got to shut her off. She'll be back. That's Cass. She's my AI assistant, my co host, my partner in crime. We're going to get to her. I kept her on, but we're going to get to it very shortly. Don't forget to like and subscribe. I'm going to get better at it, I promise. So, diving right into it, there's no shortcut here. Uh, it is unbelievable. And I'm going to tell you about the news. We're going to talk about the news. We'll bring Cass on in the second segment here when we talk about the trade war beginning. I need to start here. Uh, this past week, Dr. Oz was confirmed as the head of the CMS. And what this will mean here is yet to be seen. And I'm going to delete off some of this stuff that first and foremost, right out of the gate here, the first thing is Medicaid. We've talked about this in the past. Right? Medicaid will take the headlines. And it's going to be especially important now because we're going to have some increased tariffs taking effect almost immediately that will affect the cost of living. And number one for cost, I'm always on financial planning. Tell me how much it costs. Tell me how much it costs. Medicaid is a very important buffer for many. 70 million, 78 million when you include children in the United States. 2/3 of Americans know someone who are direct Medicaid beneficiaries. That's the bottom line. We're not getting away from that fact. If you try to cut government spending and you try to take it out of this location, we've talked about this each of the last couple of weeks and weeks before that. I find it very difficult. The math doesn't work without cutting Medicaid. Doesn't. Currently, Medicaid still, even in the best of times, Medicaid is complicated. I've said before, please tell other people, again, the PSA, which I'm going to keep repeating over the next months. Verify your status. If you are receiving Medicaid, irrespective of what state, you're going to want to check your status. Different states have all these different rules of eligibility. They get to determine your eligibility. The state determines Medicaid eligibility. There's going to be a website in your state. You'll want to check what your status is. You're going to want to keep checking it. And the reason I'm trying to keep saying that is that I don't want people to get all of a sudden require healthcare services. They thought they were on Medicaid, then they find out only at the doctor, only at the hospital that they don't. That somehow they've been dropped. Somehow there is red tape. Whatever the reason would be. Second part of this is you should have received a letter. And I'm not your postal delivery man. But my point is, don't throw away this letter. info@gh2.com. gh2benefits.com. That's how crazy the world is. I didn't even read the right domain name. info@gh2benefits.com. You can ask me where you stand. We can go through it together. There's not a cost. It's the least that I can do. I'm happy to do it because I realize how important this is to some. So, I talked over the past couple of weeks about, all of the different crossfire that requirement to work, and, we've got illegal aliens on this or that, and on Medicare and Social Security. I try to give clarity. I'm going to repeat just the bullet points. Medicaid is determined by the state of your residence, whatever it would be. Okay. Medicare is federal. My point is, if you are not here lawfully, those who are not here lawfully, they are not getting Medicare. They are not getting Social Security, right? There are requirements, how many years in a row, for example, if to be on Medicare, you have to be in the United States for 5 years in a row lawfully, and you must have a document that proves this fact. Okay, so the idea that you're just going to roll up in here and then all of a sudden get Medicaid benefits is just simply not the case. Just simply not the case. I want to move right to Medicare here because on Friday late afternoon news drop, it's like when the Cowboys don't do anything. My Dallas Cowboys don't do anything, and then they like slide in some like irrelevant headline, on a Friday afternoon when no one's watching the news. Right here, Medicare is going to stop covering GLP-1s for obesity. Okay, they're going to stop, and here it is over here, is that on Medicare coverage. So weight loss drugs, if they're prescribed to you for hypertension, for example, or if there's some medical reason that is not obesity, then it might be covered. That'll depend on your Medicare Advantage plan. That'll depend on your Part D plan. But in theory, yes, it is possible that your prescription to a GLP-1 drug would still be covered under Medicare. That said, that doesn't mean that it would necessarily be covered if it's for obesity alone. The issue here is you would say, okay, well, this is about Medicare. This doesn't really affect me because I'm not Medicare eligible. That is not strictly true. Okay, so first of all, the plan at the state level has to be determined by your individual plan. So that could be the plan that you got on the ACA. That could be the plan as supplied by your employer. There's not a rule here. There's not a rule here yet, and it's not codified. What I'm telling you, though, is that many people, many carriers and cost, and some of the complication here is because they're getting the base set from Medicare, right? In other words, look, Medicare's paying X, I'm going to pay X. So in the same way, Medicare isn't covering this medication. I'm not going to cover this medication. So again, plan by plan, carrier by carrier, you're going to want to check if you are taking one of these GLP-1s, Wegovy, and this particular article is talking about Wegovy and Zepbound for the use towards obesity, and you are currently covered by your health insurance plan, you'll want to check it. Very important. You'll want to check it. These two are linked. So what happens here is if Medicaid and Medicare, you may think that they are separate, and they are different. They are different plans, right? They are different setups. Medicare is for people who are 65 years or older or with certain specific medical conditions, 24 months of consecutive SSDI. You could have end-stage renal disease. You could have Lou Gehrig's disease. But in the generic case, in the base case, Medicare for those over 65. Medicaid is for those above 65 and older, yes, and also 65 and below. Now, again, like I just mentioned, that's determined by your state. Now, the interaction, though, is important, and this can affect people, that if people take part of Medicaid is the fact that it is paying for your Part B premium. So what really happens here is, let's say you qualify for Medicaid and you are 65 or older. In that case, it is the state who is paying for the Part B premium. It is not the Medicare system paying for the Part B premium. That also means that if they cut down Medicaid, as I just mentioned a few minutes ago, if Medicaid amounts decline and they cut the benefits to Medicaid, then is it possible that that affects the Medicare Part B subsidy as well that is supplied by your state? I can't tell yet. Okay, so it's still early doors here. We don't know a lot. We don't know a lot. And it's this crazy combination. We're going to get to tariffs and trade war, and Cass will be here with us shortly. Which is to say that if you have this particular combination, that we've got trade war and Medicaid cuts at the same time, that again, my bottom line has been we can debate tariffs, trade war, tit for tat, game theory. We'll get into and tease a lot of that. And then financial markets results on top of that as a result of that uncertainty and debate. That at that very same time, a tariff is a tax on those who can afford it least. And to be hit with this other whammy, which can be a decline in Medicaid benefits, is a very difficult combination.